Hello. I am here today with Eric Bing, Chancellor and CEO of the College of Healthcare Professions. We have some really exciting news to walk through today about CHCP's acquisition. But before we get there, Eric, I'd love to just hear a little bit about where you came from. How did you end up as Chancellor and CEO? You've had a pretty storied run with CHCP to get to today's news. But where did you come from? What was your story? How did you end up as Chancellor and CEO?
Well, thanks, Matt. It's great to be here today. And it's not your typical linear story. I never had planned on being a chancellor of colleges, but I've had kind of a diverse background. I'm kind of entrepreneurial. I will say my mother's family has been in education, women in education, since literally the early 1800s. So kind of a real long line of educators there. And but never was in my plans. But what kind of happened on it is years ago, decades ago, I was involved in bringing nurses in from the Philippines, and so I really started getting involved in the human capital side of healthcare. And part of that too is a lot of those nurses, they come into this environment and all of the work that goes into preceptorships and getting them acculturated into a hospital setting in the U.S. Versus being in the Philippines. All of those pieces take a lot of engagement, but also extraordinarily successful. And I've always been an important part of our education system. I also have done a lot of work in Africa, especially East Africa, around the AIDS epidemic, capacity building in healthcare, been in travel nursing and therapy, a lot of areas there. On the other side is we really work with adult learners with complicated lives. And in my past, I used to chair AmeriCorps in Texas, and I've been involved in food pantry capacity building and a lot of areas that help you understand what that adult learner is going through when they are trying to move up the socioeconomic ladder, but also don't have the resources. And quite frankly, a lot of our culture structure is not built for to help them be successful around education. So all these things kind of wrap together. And I was looking to put a school into East Africa and allied health, and that's how I got involved originally with the College of Healthcare Professions.
Can you just tell a little bit more about it? So you were trying to put a school in East Africa and you ended up with one in Texas.
So I partnered with the College of Healthcare
Okay.
Professions, and we were building out an online school because it was going to be heavily involved with community health, kind of around medical assisting and really
Okay.
the community health aspects. And this was also the AIDS epidemic. A lot of things were going on. So I ended up building out for the College of Healthcare Professions their online colleges back in the day. And
Oh, okay.
out of that, through a lot of twists and turns, I ended up taking over the colleges and leading them.
Cool. And what did it look like when you took over, right? Because this was now almost 15 years ago, right?
Very, very traditional school, Matt. The
Okay.
school's 38 years old. It was founded by physicians in the Houston, Texas Medical Center originally. It was completely the reason it was founded is there were shortages of healthcare professionals at the time, and they were looking to increase their ranks because they couldn't staff. And so, but it was very traditional, 4 days a week, 5 days a week schooling. Uh, and so it was very much built for a traditional learner, not for adult learners at that time. And online was part of the first piece of breaking that out to give more flexibility to students. But from there, it's obviously changed a lot.
Yeah, it's funny. There's the old adage of there are no news stories, just riffs on old stories, right?
Yeah.
And I here we are, we're still talking about the healthcare shortage, but
Yeah.
the colleges have changed substantially since that time. So if you think about the operating model then 4 or 5 days a week in person in Houston, and a few other places, I think you can correct me if
Yeah.
that's off. To today, you're operating across most of Texas, I think,
Correct.
and almost entirely online. Like, what does the difference look like to students today?
So, well, when I took over, there were just a few campuses. And again, it was traditional. And what we did is really kind of ripped out how education was presented, the modalities for adult learners, and started over. Today, there are 10 campuses across the state. It is a large umbrella online presence. The online is all the didactic is online, and then boot camp clinicals on specific weekends that they know ahead of their programs in what we're doing. We have completely changed to where our certificate programs stack and the credits count towards associates. It's very rare out there that happens. And the associates into the bachelor's, which of course is not as rare. Although, if you look at those studies, that Biden study that showed only 40% were actually transferring into bachelor's from all colleges, not as many as you would have thought. But that way we created an earn and learn model. And then the second piece of it is it's very structured. You don't have to go to a catalog, pick out what you're going to take to be a surge tech or radiology tech or medical assistant or healthcare management. It's all structured. But the other side of it is the way we present it is very much built for an adult learner that is
Hmm.
mostly trying to solve for work, childcare, and transportation. So we have 2 day on campus. The rest of their work is flipped classroom. That doesn't mean they're not doing work the rest of the week. It doesn't mean their faculty isn't engaged with them the rest of the week. It just means they don't have to come to the campus. So then there is also 1 day on campus because we had a lot of people who said, I can't do 2 days on campus, but I can do 1 day on campus. But I also don't want to do your online program with boot camps because I feel I need more connection. And so we built that out, which created a whole nother uh, opening for adult learners that couldn't do it. The other thing that's really exciting is everybody's talking about we need more daycare, we need more daycare. Well, if you think about it, if you go from 4 days a week uh, on campus to 1 day a week, you have you have solved a tremendous amount of daycare issues. And what's even more exciting about it, which is something that we hadn't even realized the implications on, is when you're only 1 day, it actually opens up more people who are willing to take care of your child for 1 day. So if the one person you had who was doing 4 days can't, it's hard to find another 4 day person, but you sure have a lot higher likelihood of finding somebody who would take the 1 day. And also transportation is a big issue. These are folks that they're aspiring professionals. They're looking for the career of their lives, but they're socioeconomically more at the bottom of the ladder. And it doesn't mean they're not incredibly intelligent and hard workers, but they don't have the money. They might only have one car. They might have to use public transportation. Texas is not a real big public transportation state, our cities. And so solving for that. And so when you look at work, childcare, and transportation in building, we do day, evening, all of those pieces. And so that's two of the pieces. Then the third one is almost all of our programs at like 98% have work-based learning. So we put them in externships where a tremendous amount of them are hired directly. And so they're getting real hands-on experience in a work setting. We're healthcare. It's very moving into a healthcare setting. They're speaking a different language, especially if you don't have anybody who's a professional in your family in healthcare, can be scary and daunting. And so we want to make it part of all of our programs. So, and the last piece is really all the student wraparound supports that we do. But it really totally changed all of the model, and it's been very powerful. And quite frankly, there's not many people that do it out there. And so there's really not a lot of options for folks that are looking for that.
Yeah, there's sort of two threads that I would love to pick out a little bit here. And the first is, it's sort of funny looking at the headlines from today's sort of broader higher ed media around, you know, kids on campus are traditional age students on campus are choosing to take online courses, and this whole like student choice aspect of more traditional higher ed. And I think what's sort of intellectually interesting to me, as I used to work at SEI, which owns Strayer and Capella,
Yep.
and I think is also true of CHCP, is those institutions are the ones who pioneered student choice and pioneered student support. And I think in many industries there's this discussion of like the fancy or the high end or the expensive parts of the industry get novel innovations first. I think what's really cool to see in education is a lot of the innovation from the past 10, 15, maybe even 20 years has come from the mass market audience, and trying to say, how do we serve uh, these non-traditional learners in compelling ways such that they'll come back? So there's not really a question in there. It's more of just like a thank you,
Yeah.
because I think it's really helping, every student, not just non-traditional, not just traditional, in an important way.
Well, I tell you, it made all the difference during COVID because if we hadn't had a lot of that pioneering work, it would have been a real, I mean, it was already a train wreck, but it would have really been something else. We were the only colleges that never shut down for a day in Texas because we were already flipped classroom. Everybody had a laptop and their curriculum was all in ebooks.
And think about how important that is, right? Of like, you were also training the people needed
Yeah.
to survive the pandemic. Like, thank goodness you were there, right? And
Yeah.
and and I think that gets at the other thread that I wanted to hit, which is, from what I understand, every student that passes through your hallways, virtually or literally, is tied to a work-based learning experience, and
Correct.
that's something that is not globally true, and not even true in the U.S., right? Where every student, even in a vocational type program or professional type program, gets a work-based learning experience. So can you say, has that always been true of CHCP? Let's start there. Has that always been true?
Well, yes.
Okay,
And I mean, not at the scale that
sure.
we work, but if you think about it, if we were founded by physicians within
They
a
were training their
network,
own people.
right, or they're training their own, they were obviously doing a lot of hands on in the, directly in the clinics. And so that's definitely been a piece of it. The thing, though, that we really have been focused on is that not only that always making sure there's true hands-on experiences for us. It's even our online ones. I was telling you about these boot camp weekends. They come in and they're sticking people in positioning on tables and practicing all these pieces. But we just believe you still at some point you need to be doing hands-on working on somebody. We're not at the point yet where all the simulation works. I mean, drawing blood, I mean, until you had to find that vein in somebody's arm. If you're a surge tech, and unless you've done 120 surgeries, these things, you want people to have this, and especially if they're ever going to be working on you. But for us, it's always been an important part, and that's why we've always heavily invested in making sure we have the clinical coordinators and continue to build out because our aspiring professionals come to us because they want a better career. They're looking to have a better life, to do something that they enjoy, not be in part-time retail, all this churn. But ultimately that means they have to have the skill sets to be successful in that. So that, and the other is these externships are a tremendous vehicle for our students getting hired directly. And so it all works because I mean, graduation is incredibly important. National certification is incredibly important, and we're all about those. But it is ultimately, we feel we've been successful when somebody has achieved a career in the field that they've been studying in, and their employer is happy with them.
Yeah, I think again, this is an area where y'all were ahead of the trend, right? And just saying like more and more programs, vocational, professional, increasingly, I think we'll even see this in more of the sort of liberal arts types degrees where it's just not sufficient to have the academic learning. You need more hands-on. And
Yeah.
I think it'll be fun, as sort of forward looking to see whether simulations start to be part of the mix for y'all. But it's just so important. And my bet, you can correct me if this is wrong, is that sort of the reason that, or part of the reason that uh, HCA was interested in y'all. Is
Yeah.
you were ahead of the curve on so many things, and I'd love first if you could just uh, talk through the acquisition. I sort of buried the lead earlier of what happened or what's under review, proposed to happen, and then maybe the thesis behind why partnering with HCA made sense.
Yes, and also I just want to say is we use a tremendous amount of simulation, and there's just super cool stuff in VR and all sorts of pieces throughout all our programs, but we don't feel that it replaces actually doing the hands-on work in our allied health
Sure,
field and all the different fields that we serve. So,
necessary but
um,
not sufficient.
yeah, exactly, exactly. So HCA. HCA, first of all, we've been working with them for decades. This isn't like something new. I mean, they're huge in Texas, and they are such an important part of the healthcare ecosystem in Texas. I mean, quite frankly, of course, the whole world. They're one of the, or the whole country. They're one of the largest in the country, and so we're in their clinics, we're in their urgent cares, we're in their hospitals. I mean, we have been engaging. The other is there is no question that there are major shortages out there. The Texas Hospital Association says that 60% of hospitals right now are operating under capacity because of staffing shortages. So, on the other side, you get the fact that we've watched the cliff. We've hit the cliff on high school graduates coming out, and that number is decreasing. And also, people have more and more opportunities to do all sorts of things. They don't necessarily all go into healthcare in what they're doing. And we have 40 million plus adult learners that have some college that haven't been successful. So when you start looking at all of these pieces out there, and HCA has really been a trendsetter on upskilling their people and investing in their folks across the board, and a lot of the innovative programs we were already doing with them. It just made a tremendous amount of sense. The fit as we can expand the depth of what we're doing. We will continue to serve all of our communities and every healthcare provider in our communities, but their innovation, their work. Sam Hazen, who is their CEO, has a tremendous vision on workforce alignment and growing people internally. And also knows the importance of staffing and staffing correctly, but also growing people in their careers, especially because of quality healthcare. So it just was it's a very, very solid fit. It allows us to continue to innovate. We have, for example, a few years ago, we developed a 12-week MA program to upskill their front office people, where in 12 weeks, all their didactics online, they come in once a Saturday for 12 weeks and they get certified in medical assisting. Well, that's taking somebody and beginning to put them on the track of a clinical career. All of these pieces. So the cross trainings, all of these things that we've been involved in, it will allow us to continue to innovate and develop. So we're really excited about the opportunity.
Yeah, and I'll add the sort of stipulation that the deal is currently under review.
Right.
We're it was announced publicly, so it's folks know about it, and it sounds like everybody's excited to do the deal, but it'll take a little bit of time before being confirmed. Maybe just one sort of question to end on as you think about the future. And, this can be the future of CHCP. It can be the future of CHCP plus HCA. It can be just general. It doesn't even have to reference directly the work that you do. Um, one of the things that I appreciate the most about the healthcare field is the ability to go from, being an MA all the way up the ladder to, a doctor or other types of
Yeah.
really high paying medical career jobs. Um, I guess like as you think about the next 5 years, is that a pathway that just continues to get even more defined? Is that something you think other institutions in other fields will start to draw from? Where do you see that trend sort of headed? Or is it sort of it's gotten as good as it's gotten and we'll live to fight another
Oh,
day?
Matt, I think we're just getting started. And one thing that I really am hopeful on is that more institutions will rework the way that they teach education to work for adult learners' lives. You're not going to leave your kid in the car. You're not going to not go to work. I mean, all of these things that are built and structured in traditional education, we just have to change. And not all institutions, but our institutions that are really serving and building the workforce. And so I'm very hopeful that more schools will do 2 days on campus, the rest online, 1 day on campus, day email, all of these things in developing. And I also think we're going to see a lot more. We're beginning to see few institutions that are beginning to allow certificates to transfer into associates. That's very powerful, not having to start over. And so many people would stop if you had to start over all of those pieces. But the other one is I think the reality is that in a lot of instances, time's the ultimate luxury for an adult learner. I mean, it's the ultimate luxury. You don't get to go sit under a tree for 4 years and do English literature, Chaucer through Pope, when you've got
Yeah.
kids at home and trying not to lose the apartment. And so I think the more that we can efficiently do earn and learn where people are working, but yet have the ability to upskill into quality careers with quality education, is going to be incredibly powerful. And I also think across the whole, all industries, that a lot of the companies that are going to be the ones that win are going to be the ones that change and really support that. Their employees to be able to grow within their careers. And because the churn, there's not the other people out there to just pick up anymore. And the other is it's extraordinarily expensive. So when I look at opportunity, I think we're just getting started. I'll tell you something, and it's not even out of the gate yet, but we are looking at and very close to launching an 11-month 60 credit associates.
Whoa, that's awesome.
Think about that. Instead of 2 years,
Yeah.
you can do it in a year. And that is something, again, that's what our students need, a degree. If we can get somebody certified in lots of different areas in healthcare, and they also have their associates, all within less than a year, and not, don't have some crazy price on it. It's just the point is it's incredibly powerful for them, providing more opportunities because of the way our system is built on you can't even apply for so many jobs unless you have a degree. So I think there's a tremendous amount of innovation. And I know there is for us, and we're excited about it. And I think that just across the board, the folks that do take advantage of it, and educational institutions and colleges that do start thinking broader than your traditional 18-year-old moving ahead, are going to have tremendous success.
Yeah, and the point that I would underline about all of what you're saying and the way that you've built your model is, I think it's sort of like trendy to talk about um, making college shorter, faster, better, right? Um, and sort of alongside that trend, you also have AI making the world more complex, right? And what I think helps weave those two strands together and in what you're talking about with the 11-month associates or the stackable certificates that have been your bread and butter for 38 years is trying to make it accessible so that you can sort of increase your educational attainment in an increasingly complex world in a way that works for you as a student. And so, like,
Absolutely.
if I had to buy, stock in a pathway, that's the pathway I would want. That's the pathway I would buy. Is saying it can't be either or, can't be just more education, and it can't be just more modular education. It has to be some combination of the two that gets you to a better sort of sense of economic mobility for degree seekers or for continuing education learners.
Yeah, and I'll tell you the proof's in the pudding. I mean, we graduated 6,600 adult learners last year. 89% of those are of color, 90% are women, 39% have dropped out of school before, a little less than 50% are parents, and we had an 82% retention rate and 81% career placement rate. And these are not your typical learners. So, I mean, it is, and the thing is just because you didn't get preschool or you had a bad K through 12, if you are given the right environment that works within your lifestyle, there is a real opportunity to still have success and get back to society.
Yeah, it is hard for me to even articulate how impressive that completion rate is relative to the norm. And I know you that's taken a lot of blood, sweat, and tears over the years.
Oh, it does. Yeah. And the
So
other thing about it is, I think AI is going to be really exciting and a big opportunity to use because we're very focused on everybody has a name, they have a story, they have hopes and dreams. They're not a number. And the bigger you get, the harder that gets to do. But the other is when you really use data and you can engage and be tracking and seeing where everybody is every day, it allows also to have that interface. And so everything we're doing is how do we create an easier environment, not push them through ever. We're huge on accountability. Accountability is caring as far as we're concerned. And but also being able to catch before things get out of hand to keep them moving forward because of all the things that are going on in life, but it doesn't mean they can't be successful. And the people who come to our colleges, they want to be successful. They know it's not going to work doing part-time retail. They want something better for their children. And I mean, I've got the greatest job in the world. I mean, how can you beat being able to uh, see all those folks at graduation? And on average, our graduates bring 10 or 11 people to graduation.
oh,
And you see
that's
those
amazing.
kids and cousins and, uh, you know, uh, you're sitting there talking to a mother whose daughter's just graduated and she goes, I just enrolled last week because I think I
Mm,
can do this now. I mean, you get it, Matt. You've been there. But it's possible. But it's not simple either. So,
yeah.
but I think we have a lot of opportunity in this country, and I hope that more colleges pick up on these threads because you don't have to do it all. Even pieces of it can make a huge difference in an individual's life.
I look, you and me both. And I think that stories like this uh, prospective exit to HCA will hopefully embolden more leaders to take cues from what y'all are doing, and I think that's really important. And I just want to say thank you. I've
Yeah.
taken far too much of your time, but I'm really grateful for it. I am excited to follow along as the acquisition gets further along, and hope we can do this again as you hopefully are able to bring even greater resources to bear on this problem under the aegis of HCA.
Well, I thank you, Matt, for taking the time to allow us to share our story, and I'd love to come back on and tell you what's coming up next and what has happened since we've last talked once we're there. So
Awesome.
appreciate it.
Thank you.